Hi, everybody. My name is Natalie Yeadon. I'm the co-founder and CEO with Impetus Digital. At Impetus Digital, we have built some of the best-in-class asynchronous and synchronous virtual collaboration and communication tools. We have worked with life science companies from across the globe over the past 14 years to help them with everything from virtual advisory boards, digital investigator meetings, online medical education. And since the launch of our award-winning Insight Events platform, we've also been helping pharmaceutical companies with large corporate events, MSL and sales rep training, innovation hackathons, and everything in between. But more importantly at Impetus, we really believe that everything starts with a conversation. And from these big, hairy, audacious conversations with some of the leading edge thinkers, the digital provocateurs, and some of the healthcare leaders, we can all work together to collectively and positively disrupt healthcare. So I'm super thrilled to having one of these thought leaders at the table with me today. This is actually Dr. Gil Blander. He's actually an internationally recognized expert on the basic biology of aging. This is something that we all are going to be interacting with at some point in our life. He has a PhD in biology from the Weizmann Institute of Science and a post-grad research on aging at MIT. Gil's specialty is applying blood biometrics to inform custom nutrition and lifestyle interventions. He's on a mission to help people unlock that information that's stored in their blood to improve our overall health span. And he's created a company, and it's called InsideTracker. We're going to talk about that a lot today. And that's exactly what that company does. So they let people order up really deep dive biometric testing and combine those findings with the DNA insights and potentially also a fitness tracker to help create a hyper customized lifestyle intervention action plan. We all want something that's very specific to ourselves, and this will help to impact the markers that matter the most. Welcome, Dr. Gil Blander. So happy to have you on the show.
Thank you, Natalie. It's my pleasure.
Absolutely. Very interesting. I think the audience would first and foremost want to get to know you a little bit. I think it would be really great because, again, your background with a PhD in biology and then also, coming from MIT. Tell us a little bit about your career trajectory and how you ended up becoming an entrepreneur and starting up InsideTracker.
Yeah, that's a great question. From very young age, I was fascinated by the aging process. And I wanted to know how can I live forever and how can I prevent or delay the onset of aging-related diseases. So that's why I decided to study biology. And when I came to the Weizmann Institute, at that time, aging research was a bit early, so I couldn't find any lab that studied aging at the Weizmann Institute. So I decided to join the best lab that at the Weizmann and convince the professor at that lab to allow me to study aging, which was really interesting. And then after that, I identified the best lab that studied aging in the world. That's the lab of Lenny Guarente at MIT. So I joined that lab and spent 5 years there. And it was really great time, and I really enjoyed it, and I learned a lot. But also I learned that there is a lot of interesting activity and research outside of the academia in the industry. And I realized that maybe I can even contribute more to humanity if I would start my own company than being professor in the academia. So I decided to leave the academia. I worked in a system biology, computational biology company in Cambridge. And during that time, I came with the idea of InsideTracker, which is actually allowing people to live longer, better life based on what's happening inside their body.
Beautiful. I'm going to take a sidetrack just for a minute to investigate a very nebulous topic that nobody really wants to talk about, and that's aging. It always appeared that aging was some surreal thing that just happened naturally, and there's really nothing you could do about it. Suddenly, new people came on the scene. I'm thinking about people like Aubrey de Grey and then Dr. David Sinclair and others that have been doing a lot of really deep research and coming up with a concept that's a bit almost blasphemous, which is aging could really just be a health condition. Can you speak a little bit more to this, to the premises around what aging actually is?
Yeah, definitely. So I agree with you. In the past, everyone looked at aging and said, "Hey, it's something that we need to deal with, and it will happen, and nothing to do." And in the last, I would say, a couple of decades, we see that there is a lot of progress and there is a lot of data, especially from model organism, that show that actually if you overexpress a gene or delete a gene, you can increase the lifespan of those organisms significantly. There is example of the lab of Cynthia Kenyon from UCSF that she showed that um, uh, modulating the insulin pathway in worms, you can make them live up to 2x or 2 times longer than what they usually live. And studies from Lenny's lab, Lenny Garante lab at MIT, showed that a SIRT1 pathway, when you do it in yeast, you can make the yeast live much longer. And then they show it also in worms and in some mice. So there is a lot of interesting discovery from basic study in the academia that showed that actually aging is not something that you cannot do anything about it. It's something that you can. And they showed it in some model organism, but there is some data in, let's say, higher model organism with caloric restriction. When you restrict the amount of food that you feed the mice or monkeys or other organism, you can see that those organisms live up to 30 to 50% longer just by cutting the amount of calories that they got fed. And on top of that, there are some interesting data really recently even about humans. So metformin, which is a drug for pre-diabetic, there is a lot of data that's starting to appear that actually, even if you give metformin for humans that are not diabetic or pre-diabetic, you might see an effect of increased lifespan. Again, I'm not recommending anyone to consume metformin yet. There is a clinical trial that is happening right now by Nir Barzilai, which is a professor at Albert Einstein in a university in New York City. And he's trying to see whether you can translate the effect of metformin on diabetic people to healthy people. So I think that the bottom line is that there is a lot of movement in the aging longevity field. And I feel very optimistic that we might live longer than what we expected to live.
Beautiful thing. Let's actually start to investigate a little bit about how you're trying to impact the aging process with your company InsideTracker and then the technologies that you've incorporated. So let's actually just start off with what the process is. When, for example, I decide to come and I come across InsideTracker on a website or on my phone, what is the very first thing, the entry point that I'm coming in, and take me through the process that I would be as a user of the InsideTracker software, what my experience is going to be?
Yeah, it's a good question, and it's a pretty straightforward process. So you can come to our website, InsideTracker.com, select the plan that you want to buy. You buy it, and then you have a few options to receive the blood test. If you have a blood test ready from your physician or from your health insurance or life insurance, you can basically buy this plan and upload the result and receive the value of InsideTracker. If you don't have it, you can go to Quest Diagnostic, which is our partner. It's the biggest lab provider in the US with thousands of clinics around the US. So you can go there, get tested, we'll receive the result, and then you can enjoy InsideTracker. If you don't want to go to Quest Diagnostic, we can send a phlebotomist. It's basically a technician to your home or office, and he can take the blood, he or she, and send it to our lab partner, and then you'll see the result. And if you don't want to do that, we can send you a home kit. It's basically a kit that you prick your finger, a few drops of blood, send it to our partner, and then we'll give you the recommendations. So that's about the blood. We're also testing DNA. So similarly to the blood, if you have DNA result from 23andMe or Ancestry, you can upload the result in our website. If you don't have it, we have a DNA kit that we can send you to your home, and then you can test it, and we'll give you analyze your result. And last but not least, we have also integration with fitness trackers. So currently we have integration with Garmin and Fitbit, and very, very soon we'll have also integration with Apple Watch. So basically you can connect your fitness tracker and receive even a better knowledge or better understanding of your body.
All right. Wow. So lots of entry points and certainly lots of diverse data points that are coming into your system. So when these data points come in, what is your technology? Sort of what is the secret sauce? I'm assuming that your algorithm and your machine learning is based on something called Segterra R or Segterra X. Can you explain about what apparatus you've set in the software in the back end?
Yeah, so what we developed from early days is Sectera X, which is basically an expert system. So we have a team of scientists that mine the literature and extract from the literature all the relevant information that related to blood biomarkers or fitness tracker data or DNA data, and basically take it into Sectera X and structure it in a way that, for example, if you have high glucose and high LDL and low vitamin D, what is the best intervention that's good for you? Okay, so we have thousands of those in our database. And what Sectera X doing is looking at that and combining it with your data. What is your level of glucose? What is your level of LDL? What is your demographic information, age, gender, ethnicity, and so on? What is your athletic activity? What do you do? What are your food preferences? And a lot of information about you. And then it's cross all of it together and giving you the best recommendation for you. So from thousands of possible intervention, we are bubbling up the 5 or 10 best intervention for you. And that's based on your blood, DNA, fitness tracker, and all the information that I mentioned before.
So let's actually just tease apart each of these components. And again, because you are an expert in blood biomarkers and what this actually means about your health. So when we do a blood test, are people just doing a regular CBC, just take your blood and there's an analysis? What specifically are you looking for in the blood? And is there anything special that's being analyzed in that?
Yeah, so most of our blood biomarkers are normal blood biomarkers that your physician will do, as you mentioned, CBC and lipids and other. We are having some markers that, let's say, are more bizarre or more exciting or more relevant. Like, for example, your physician most likely won't test your testosterone. Your physician most likely won't test your cortisol, which is a stress hormone. Your physician will most likely won't test creatine kinase, which is a marker of muscle damage. Unfortunately, your physician won't test usually your B12 and the vitamin D. So we are basically allowing you to either use the data that you receive from your normal physical, which is a bit limited, or if you want to, you can buy from us a plan that covers all the direction and we can understand your body in a better resolution. Oh. Another thing that we are doing is in contrast to what you receive from your physician, which is basically a normal range. Let me give you an example. For glucose is 65 to 99 for everyone. Doesn't matter if you're male or female, athletic, active, or a couch potato, and so on. We are giving you an optimal range based on your age and gender and ethnicity and athletic activity. And that's something that we develop based on our big database and data from the literature. So in the example of glucose, we have data that show that if you have a lower glucose in a younger age, you have a better chance to live longer in older age. So we are looking into that and then coming and telling you, hey, even so that your glucose is in the normal range is not optimal. So it's better for you to decrease it a few units in order for it to be optimal.
Now, there's a lot of new sort of biohacking, biometric type of tools, especially since COVID-19. We've been seeing a lot of things around decentralized clinical trials, and that has resulted in sort of at-home wearables and other sorts of things so that patients could do things like patient-reported outcomes. Now, these tools are now, becoming increasingly available to everybody, and same with telemedicine and all these other things. So when we think about these kind of one-shot blood tests, is there some discussion happening with you about an ongoing blood test or the use of things like 24-hour glucose monitors? If, how and when will these sorts of entry data points also be seamless with your system?
Yeah, it's a great question. And actually, we established a few months ago InsideTracker labs that looking at all the new technologies. And one of them is CGM, which is the continuous glucose monitoring. So we are looking into that and trying to see when it will be ready for the normal user that is not diabetic to give them a real insight. Because today there are a lot of, as you said, there are a lot of companies that are doing that and using those CGMs, but they don't have enough data to come and say, what is the right range of a level of glucose, continuous glucose, that I should have as someone that is not diabetic? There is no database like that. There is no literature about that. So we are trying to be a bit more conservative and try to build that before we'll come to someone and say, hey, your continuous glucose is too high or too low, because really there is no data about that. So what the biohackers are doing, or the, let's say, the early new companies that are doing, they're giving you the information, but I wouldn't trust the recommendation that they have, because it's not backed by peer review publications yet.
Right. You've also mentioned Ancestry, 23andMe, and there's many, many various DNA companies, across the globe that also do this kind of work. And there's a lot of really interesting data that comes out of, the types of genetic makeup that you have and all sorts of things. Talk a little bit about what these genetic makeup look like, and what do we know and not know about what the information that comes from that?
Yeah, so I think that that's a great question, because there are some provider that giving you some nutrition recommendation based on DNA. And I think that that's a bit far-fetched, because we see a lot of data in the literature that show that the effect of the DNA on your nutrition and your exercises might be up to, I don't know, 10% or 15% or 20%. But the rest is really environment and the situation of your body today. So what we are doing, we are combining the blood and DNA together. And let me give you an example. Let's stay with the glucose for simplicity. So let's assume that I have high glucose, but also I have a high risk to have high glucose, versus if I have high glucose, but I have low risk, low genetic risk to have high glucose, the recommendation and the intervention and the interpretation that I will give you will be very different based on your genetics. So basically the genetics allow us to give you a high definition picture of your body. Because if you have high glucose and high risk for high glucose, basically you have been born with the bad cards, and you can try to play them as good as you can, but the cards that you got are not so good for glucose. If you have a high glucose and the low risk for high glucose, basically you have born with the good cards, but you are not playing them well. So there is a better chance that we can help you modulate it using some intervention of changing your nutrition and lifestyle and exercise. So I think that what the genetics or the DNA giving you is another layer of information, how to intervene and what kind of intervention will work for you.
Everybody is looking for that panacea database, the database that has not a lack of bias, that has a multitude and a diverse and an inclusive group of really of data, worldwide and globally. You're saying that there's lots of different people playing in the DNA space, lots of people playing in the biometrics and blood biomarker space. Is there a worldwide effort to consolidate and to build a database that everybody's equally sharing, or is everybody kind of doing this on their own? And I think a corollary to that question is how is your database being built, and is the people that are in it based on the most elite athletes, and is there a sort of an intrinsic bias in the machine learned algorithm that's in there right now, and do you see that changing over time?
Yeah, you ask a lot of good questions, so I'll try to answer them one by one. I'm not aware of one database that inclusive of all the data that we have. Unfortunately, even databases that built by the academia. So you have a database in the US, and then you have a database in the UK. And I know now that the Weizmann Institute in Israel building a database of their own, but all of them are separate and not everyone having access to each database, which is unfortunate, but that's the situation. Our database is, I think that it's unique because we have a database of what I call free-range humans. So a lot of the databases have a lot of data of sick people or people that basically volunteer for clinical trial, and basically that's not the affluent person that looking at us right now in LinkedIn. We are too busy and we are doing a lot of work, so we don't have time to be a guinea pig of a clinical trial. So what is nice about the InsideTracker database is that it's the biggest database that I know of free living humans. But on top of that, it's include blood, DNA, and fitness tracker data, which is very unique. And I don't know of any other database that have the magnitude and the kind of population that we have. And to the point that you alluded about professional athletes, we have a lot of those as well. So for example, now we are working on publishing a paper about 15,000 people, runners, from a couch potato to someone that ran a 100 miles ultra marathon. And we are looking at the effect of running on blood biomarkers. And what we have seen is really cool. You can see that all the metabolic markers, you can see almost a linear relationship between the level of the metabolic markers and the amount of running that you have. So if you are an ultra marathon runner, on average, you will have a very good metabolic markers. If you are a couch potato, on the other hand, on average, you will have a pretty bad metabolic markers. And in between, it's depending if you are 5K, 10K, or marathon, you can see that there is, in most of them, there is a linear relationship. And we done some, in this paper, we done some research using a new technology such as Mendelian randomization that allow you to actually do some causal experiment in observational studies. And we've seen some interesting results. So I think that that showed the power of our database. You have a database that is so rich with so many people, so you can do a lot of studies and help InsideTracker users to receive better recommendation, but also help humanity to understand and, for example, know what is the best amount of running that you should do without getting crazy. Because again, your population and the people that are listening, they cannot, most of us cannot run marathon or ultra marathon. We're too busy or we are maybe too old to do it, but maybe 5K is enough, or maybe 20 minutes a day of running is enough. So our database will allow us to find that and then give you the recommendation. You don't have to be ultra marathoners in order to have a good metabolic markers.
So what is, so at the end of the day, in terms of analyzing all of this important biological data, what does your system, when you actually come up with a customized referral of an action plan, what, if I was somebody who was using InsideTracker, what am I going to be expecting from that action plan? Is there specific foods I should be eating or avoiding? Is there specific kinds of exercises I should be doing or avoiding? What does my action plan say to me?
Yeah. So our action plan is built from a 4 different group of intervention. It's food, supplement, exercise, and lifestyle changes. Okay, so let's start with food. We have today available for us around 8,000 different food items if you look at the USDA catalog. And if you look at the average American in an average week, and I'm inviting you to test it for yourself, you will see that on average, we are only consuming around 20 food items, okay? So we have a universe like that, and actually we are using a very small part of the universe. So the first the vision that we are trying to communicate to our population is first, you have a variety of foods, and we are trying to expose you to you, and also recommend to you. For me, avocado might be great. For you, it might not be good. So we were telling you, okay, this is the right food for you. And obviously, we're giving you a lot of alternatives. So, for example, I don't like avocado, so I can eat something else that can replace the value of avocado. Um, so that's about food. So we are giving you a lot of specific recommendation about food. Then a supplement. Supplement is something that is interesting and important, and we have seen that actually 98% of our users are willing to take supplement. When I started the company, I was sure that a lot of people say, no, supplements are bad and I don't want to take it. But actually, the American population love supplements. So we have a battery of almost 100 different supplements that we can recommend to you based on your needs. So we are fitting the right supplement for you, okay? And again, my philosophy is it's better to do it with food, but sometimes you're too busy or it's too hard, or in the example of vitamin D, it's very, very hard to get the right amount. So we have the second line of intervention is the supplement. Then you have the exercise and lifestyle. So we can find whether you are exercise too much or too little, because we have some markers related to that. We can see what are the level of your testosterone and creatine kinase and cortisol, and the iron markers are super important, especially for young women because the monthly cycle. So we've seen a lot of young women that have a too low level of iron. And by the way, the current healthcare system is not looking into that. So we are giving them some recommendation with nutrition and with supplement how to improve it. And then you have the lifestyle. If you're too stressed, do meditation, when to go to sleep, how to sleep. So the mix of all of that, that's what you will receive. So it's an holistic solution. We are looking at 43 blood biomarkers and a lot of DNA scores and some fitness tracker. We are running it via our algorithm and then coming telling you, hey, Natalie, for you, you should do X, Y, Z, and don't do A, B, C. And that's the plan that you are starting to follow.
Most people are, they, when you talk about like different kinds of personalities and what have you, people have a tendency to do better with behavior change when they're doing it in a community. I mean, we see this all the time with social media and communities and having support. And again, this concept of like the service piece, which sometimes goes out of a SaaS model, which is real life human beings and coaches and things like that. Outside of really highly enthusiastic, intrinsically motivated individuals who will do everything regardless of what somebody tells them or not, and they'll just follow the science, many people don't fall under that category. What does InsideTracker have to say about those individuals who need to be coached or belong to some sort of a community to keep them motivated to make these changes based on their action plans?
Yeah, so first of all, I think that behavioral science is very important. And I think that a lot of digital tools are not using behavioral science because it's hard, or it's some people even say that it's not a real science, which I don't disagree at all. So we are taking it very seriously. And just to prove it to you, I have a session with a professor of behavioral science actually in half an hour for all the company, to train everyone in the company, including the marketing and customer success and the product managers and the scientists in the behavioral science. And we are going to get even much deeper with that and have a lot of session and try to inject behavioral science into the product. We also have a group of InsideTracker, we call it InsideTracker Insider in Facebook, that people are sharing information. And I was surprised how much people like to share and ask and receive feedback from peers. We also have, if someone need to receive some support from RDs or nutritionist or someone else, we're also supplying it to our users. I'm doing it because I want to learn from them, or we are doing it because we want to learn from them. My vision is not to have a product that someone will have a human being talking with you. We want to do it completely automated and scalable, But we realized that we are not there yet. We are much closer than we have been a few years ago, but we are not there yet. So our staff is talking with our customer, helping them to solve the problem, and by that also learning what are the problems and try to integrate it into the product. So hopefully it's answer your question, but still I think that there is a lot of room to grow in the behavioral science. I completely agree with you.
And it sounds like a very holistic approach, which makes sense. Now, at the end of the day, all of this is being done. The biometric and all of the analysis of the biomarkers being fed into your smart algorithm software system and basically exuding an action plan that includes all those 4 prongs: nutrition, supplements, activity, and lifestyle changes. At the end of the day, there's a guidepost, or there's goals associated. Are there specific biomarker goals, or is the ultimate the ultimate goal like increased lifespan? So what exactly is lifespan helping people to orient themselves around their ultimate goals?
Yeah, it's a good question. And actually, we have around 10 different goals that the user can select on top of the biomarkers and all the information. So user can come and say, let's assume that you are an athlete. So I want to improve my endurance, or I want to distress, or I want to decrease fat in my body, or I want to sleep better. We also have the goal that called improve inner age. We have a product that called inner age that basically we can calculate your inner age that and compare it to your chronological age. And that's something that is very popular, obviously, because our users want and try to live longer. But if you ask me what is the right goal for everyone, we call it the overall health. So in this overall health, we are looking at all the biomarker, all the physiological markers, all the DNA, and we're coming and telling you, or the algorithm coming and telling you, those are the most important biomarkers that you need to work on, and those are the intervention, and we grade them from top to bottom, and that gives you the holistic view of your body. But if you want to focus on specific goal, there is the capability for you to do that.
Absolutely. I was also curious in terms of the ultimate goal, which really is increasing lifespan. Has there been information from centurions or people who over 95 or in their 90s and their hundreds, and testing their biomarkers and seeing where they are? I'm trying to figure out how people are being steered in that direction if they want to become 100 or ultimately 150. I mean, I'm thinking about people like Ray Kurzweil and other folks who are kind of has their eye on the ball. There is, what exactly are you using of current individuals at that age group and incorporating those into your algorithms?
Yeah, so that's something that we very close to my heart, as you know. And we started a podcast that called Longevity by Design. And actually, we interview and going to interview all the smartest and the brightest scientists in the field of longevity. So, for example, Nir Barzilai is that I mentioned before, is a professor that study specifically long-lived humans. And the major finding that he found is that those long-lived humans usually have a lower amount of growth hormone, okay? So when you have a lower amount of growth hormones, basically you have a tendency to live longer. You cannot intervene in that, but that's something that is interesting to know. We have other people that looked at the other aspect of longevity, like, for example, David Sinclair, as you mentioned before, and he's seeing the CO2 pathway as important one, and I'm sure that you and your audience heard about all the NAD analogs that some people are taking. We mentioned metformin before, and that's definitely an interesting drug to look at. There is another drug that is a very popular, at least in aging research, called rapamycin, that it's a drug that influences a protein that called mTOR, or inhibit it. All of them are still in research, so some in humans, some in mice, some in dogs. And I'm not sure that it's those are already ready for humans to take. Some people are taking it. I can tell you that I'm not taking them because I would like to be a bit more careful with my body, but some people are taking it. I think that if you really want to live longer, a better life, just follow the right diet, the right lifestyle, sleep well. And if you really want to be super duper, come and do InsideTracker and we'll give you in the 80-20 rule, the 20%. But it's very important to do that. I can just tell you that this morning, my mom is 88, and I called her. She lives in Israel this morning, and we spoke about she fall down a few times in the last few months, and it's very common in the elderly that they are falling down. And she told me she's taking care of herself very, very well. And she's having a Pilates trainer and all of that. And she told me, yeah, my Pilates trainer told me to start working on my balance and stand on one leg and all of that and build my muscle. And I think that one very important part of aging is that we are losing muscle. So it's much easier for us to build muscle when we are in our 20s than our 70s or 80s. So I would strongly recommend everyone that is starting to be above the 20s or 30 to continue to build the muscle, to be sure that you have a balance and flexibility and keep the endurance and feed your body well. It's like a car. Don't feed the body with the lower grade gasoline. Give it the best gasoline and don't feed it too much. It's a lot of common sense, and you'll have a much better chance to live longer.
You mentioned some really important points there. And I think one thing that is very prevalent in society today is the whole science around inflammation. And there's so much about that. We're thinking about, for example, Alzheimer's being sort of part of the whole situation around, cardiac and all those sort of things, the metabolic syndrome. And a lot of that might be due to overarching inflammation and lots of things around that in terms specifically around food and glucose. I know one of the questions here is even about FODMAPs diets and the kinds of foods that cause inflammation. I'm also just curious about what your thoughts are on inflammation in general, as a general term, and that spurring on health issues and really ultimately aging.
Yeah. So there is a term that called aging. So it's definitely inflammation. It's a key thing in longevity and aging. And going back to InsideTracker for a second, we have almost 10 blood biomarkers that just look at inflammation. So in the CBC, you have a lot of markers. We have HSCRP and other markers that are related to that. And definitely in inflammation or chronic inflammation is not good. Even when you are running, after a run, you have some increase on some inflammation markers, but that's actually healthy because it's make you to be in a bit in a stress situation, which is good for our body, not to be too cocky and feel good. It's always good for us to work on our toes. But I think that chronic inflammation is pretty bad, and we really need to take care of it. Diabetes, one of the causes of diabetes is basically chronic inflammation that compromise the activity of our beta cells. And I don't know if you know or not, but if you look at the lifespan of a diabetic versus not diabetic, on average, it can be up to 15 years difference. So it's pretty significant. So yeah, definitely inflammation is a very important ingredient of aging or longevity, and it's important for us to try to keep it as low as possible in a chronic way.
Another word that I think a lot of us hear in sort of the biohacking or in the health space is a concept called autophagy. And I know that you'd mentioned earlier about various ways of creating a type of hormesis, and hormesis being sort of a good stress or a eustress. Things like, maybe high intensity, cardiac training or weightlifting, cold showers, saunas. So these areas where there's extreme in a temporary sense to stress cells in order to create this hormetic effect. And and I'm also thinking that you mentioned the idea of fasting and caloric restriction. Can you talk a little bit about some of the hormetic effects of some of the things I spoke about, and this idea around autophagy and basically cellular cleanup or apoptosis?
Yeah, yeah, and I think that there is also it's in the last few years also the senescent cells that come into. So senescent is basically, just to explain to the audience, is our cells are replicating, and they cannot replicate forever unless they are stem cells. So let's say after 60 times of replication, the cells stop replicating and become senescent. Basically, they are cannot replicate, and they are like a zombie cells. They are there, but they are not doing anything. But what was found recently by Judy Campisi from the Bach Institute in California is that actually those senescent cells are also secrete some molecules that actually influence other cells, and that might be a big reason for aging. So there is now a field that called senolytic. How can we kill the senescent cells, and by that allow our body to live longer? So there are a few companies already that are doing that. So it's related to the apoptosis that you said. Yeah, a clean up of our body and clean up from senescent or other cells is very important. And like anything that related to aging, all the processes are starting to be slower and less efficient when you are getting older. So it's definitely a problem. Going back to the intervention that you mentioned, for example, caloric restriction. So caloric restriction is something that really have been shown to be, let's say, beneficial for longevity from the 1930s. So there is a lot of evidence about that. Looking at a sauna and a hot shower and cold shower and all of that, there are some evidence, but the evidence is much lighter than, let's say, caloric restriction. So I would say take it in a grain of salt. Yeah, there are some evidence, but they are, I would say, very light. And some biohackers making a lot of that, but I'm not sure yet that it's something that it's, let's say, bulletproof, something that I would recommend for every person to do. But doing intermittent fasting, delay a bit your breakfast and have your dinner a bit earlier and have a window of only 8 hours of feeding. That's a great intervention, and it's pretty easy to do. I'm doing it for the last, I don't know, 15 years, and it's not too hard. Just remember that in the feeding window, don't eat like a pig. Eat carefully and feed your body well, because if you do that, but then eat cakes and chocolate and I don't know, drink soda, that won't help you a lot. So I think that again, you need to take care of your body in the right way and have a lot of common sense.
A lot of other things have kind of intervened in this sort of health space. Some things considered to be scientific, some a bit controversial. And a lot of people are still, the jury is still out. Things like mitochondrial dysfunction as being another reason for aging and how to fix that, so-called, and is there biomarkers for it? We also hear a lot about things like telomeres and telomere attrition. And also another fairly controversial concept around resveratrol.
Yeah.
I was wondering if you can kind of speak to some of these more controversial topics as it relates to aging.
Yeah, of course. So let's start with resveratrol. So resveratrol is a small molecule that actually have been shown to be antioxidant. And I think that it was in 2007, David Sinclair from Harvard Medical School found that resveratrol is a SIRT1, which is a SIRT2 homolog activator. What is interesting about resveratrol that is fairly concentrated in red wine. So the journals, let's say all the, not the scientific journals, but the normal journals pick on that and made a lot of noise about that. And I think that there are some evidence about resveratrol that is an activator of SIRT1, and there is some data that show that resveratrol is good for you. I would say that if I'm looking at the data from InsideTracker database, Resveratrol can be a pretty good intervention for someone that have a high glucose that is in the pre-diabetic or diabetic level. So again, the example that I'm showing to you right now, it's good, but for some subpopulation. I'm not recommending everyone to take resveratrol. It's good for some subpopulation, and that's again show the strengths of InsideTracker. We can tell you exactly what supplement is good for you, and not based on reading it in men health or women health. Telomeres. Telomeres or telomeres. So telomeres are the end of the chromosomes, and the issue with the end of the chromosome that it's very hard to replicate it because our polymerase, DNA polymerase, need to go from one side to each other, and it's very hard for it to onboard on the end. So every time that we are replicating the cells, the telomerase becoming a bit, the telomeres, sorry, becoming shorter and shorter and shorter. Measuring the telomere lengths can sometimes show there is some correlation between telomere lengths of specific cells and the age of a person, okay? Now, if we are talking about telomerase is an enzyme that somehow can replicate the end and make them longer. And that's what stem cells have. So stem cells, the cells that can replicate forever, have telomerase active, and then they can grow faster. Also, some cancer cells have telomerase in order to allow the cancer to replicate forever. So there is some, I would say, a balance between becoming immortal and acquiring cancer, and that's a balance that the scientific community need to look into that. Definitely, telomere and telomerase are interesting and important. I'm not convinced yet that the shorten of the telomeres is the cause or the effect of aging. So that's something that, at least for me, it's not 100% convincing to say that if you have a shorter telomere, that means that you are aging faster, or whether that's the cause. What was your...
And mitochondrial dysfunction.
Yeah. Mitochondrial dysfunction is... I think that there is a lot of work right now in the scientific community about mitochondria and the effect of mitochondria on longevity. A lot of the work that David Sinclair is doing is about the NAD analogs, and if we want to go a bit deeper, SIRT1 or SIRT2 is an NAD-dependent deacetylase, meaning that is activated by NAD and remove acetyl group from DNA or from other protein. Okay, there is some data in the literature that suggests that when we are becoming older, the availability of NAD becoming lower. And that's why David and others said, let's consume some NAD derivative, and they will increase the level of NAD. That will activate SIR2, and that will allow us to live longer. So that's one way of looking at mitochondria. Another way is if you look at the metformin, one of the targets of metformin is actually complex in the mitochondria. And so there are at least a few pathway of longevity, the SIR2 and the metformin, AMPK, that actually showing a relationship to mitochondria. So definitely the mitochondria dysfunction, and then leakiness of reactive oxygen species into the cell and maybe into the nucleus, and harming the DNA. There are a lot of evidence that that's happening. One potential intervention is the NAD derivative that I mentioned before, but I'm sure that there will be many other in the future.
I do have to ask you one last scientific question, because this is a burgeoning area and it's gigantic and can be quite complicated. So thank you for making it simpler for people to understand. But hearing also a lot about a lot of research lately about the Yamanaka factors and the whole area around doing things like partial cellular reprogramming. Curious about where this sits and fits in this whole longevity economy.
Yeah, so just an explanation for the non-scientific audience. There are a few factors that you can inject into a cell, and it will transform the cell from a normal cell to something like a stem cell. So it allows the cell to replicate forever. At least one of the factor in those three factors is actually a oncogene that actually have been shown to make cells, transform them to a cancer cells. So there are some experiment, a lot of experiment actually in the academia that are trying to do that without this factor. And there are a few publications that show that. And the idea is, let's say, I don't know, take a failing liver and make and allow it to repair using injection those factors into the liver or into the eye or into the, I don't know, the heart. So I think that it's a very exciting field. I'm very optimistic about it. To tell you that today you should take those, no way, don't do it. Nobody is doing it yet, as much as I know. But it's definitely something that in 5 to 10 to 20 years, there is a lot of bright future that maybe we can, if you have an issue with your liver and your fatty liver, maybe we can take a few cells from there, create the liver, and or even in the body do that and allow it to regenerate.
So lots of interesting bioethical questions. And one that sort of always surfaces to the top as well, which is if you ask the average person, do I want to live forever? And people will oftentimes kind of shrug their shoulders and say, well, you know, if I was unhealthy, why would I want to? So how do you sort of balance some of the ethical questions about living forever and all of the pushback that comes down to consumerism and economics and basically quality of life for people? You know, what is really the rationale for wanting to increase your lifespan?
Yeah, so I think that first we need to distinguish between lifespan and health span. So lifespan is the time that you are live between birth to death, okay? And then you have the health span, and the health span is the time that you're alive between birth to the first time that you have a chronic disease, okay? And our goal in InsideTracker is actually to increase the health span, because nobody wants, as you said, to be connected to a lot of tube and lie on a bed for 20 years. That's not fun. So the goal is to try to increase the health span as much as we can, and also the lifespan if you can, but together with the health span. So the goal is for us, let's say, to live to 150, but until the last moment of your life, you can still hop on your bike and take a ride or climb a mountains or, I don't know, do the work that you like to do. So it's definitely the health span is what is important and not only the lifespan when you are sick. It doesn't make sense at all.
Well, I found this incredibly inspiring. You're a wealth of information, Dr. Blander, and I certainly am very intrigued, being a bit of a biohacker myself, of wanting to check out InsideTracker.com. So anybody who's listening, I would really encourage you to check out the website, see about getting involved and like using this. This sounds like it's phenomenal. So thank you so much. I want to appreciate everybody's time for listening and asking some interesting questions. And, you know, at the end of the day, if you were interested in this conversation, I also encourage you to, first of all, we're leaving Dr. Blander's contact details in the show notes below in case anybody wants to partner, connect, learn more about InsideTracker, but also check out impetusdigital.com. These are the kinds of conversations that we have with a lot of pharmaceutical companies and also their customers, physicians, allied healthcare providers, patients, payers. How do we get more involved? How do we do things like, how do we actually do things like increasing health span, going beyond the pill? How do we start talking about some of these other lifespan, health lifespan sort of factors, including these different kinds of apps? So how do you go beyond the pill? So those are the kinds of conversations we do asynchronously and synchronously through a series of touch points. Thanks for everybody. We really appreciate if you can like and subscribe to our channel. We would also appreciate if you can leave us some feedback on iTunes. I also want to say thank you so much, Dr. Gil Blander, for a fantastic conversation today.